if you are not verifying benefits, those three things, telehealth, self-funded versus group, medical versus preventative, will literally change the game relative to whether or not you get paid and how much you get paid, as well as whether or not your patient has to pay you anything for it. And then the other information that we learn in the context of verifying their benefits is, how do we have to bill, and exactly what should we expect from a payment standpoint, right? But until you have that confidence, the livelihood of your practice is your cash flow. And your cash flow will determine 100 exclusively is how you understand your patient's benefits. And so if you are sending this off to your patients because you are either too busy or you just don't want to do it, you honestly are jeopardizing the future of your practice. You cannot get better at a skill you don't practice. And whether or not you want to practice this skill, like I didn't want to practice the skill of practicing my violin, but the only way for me to get better was putting in the reps, right? And for many of you guys at this stage, and I say this stage because there is going to be a time when you watch this video and you're like, I'm so glad I did the things that Amy P told me, because now I bill with confidence and clarity. But this is a necessary skill that many of you guys are outsourcing to your patients, and you're missing out on that valuable lesson, which is probably a lot of mistakes in the process. So that is how you, kind of that first piece, the most important piece of the puzzle works.